Hi guys, my name is Suman Roy and welcome to my channel Suman the Pharmacist. Today is a very special day because today is the Independence Day, and with this I will discuss with you today the antibiotic resistance. So antibiotic resistance is the ability of bacteria to protect themselves from antibiotics. So guys, antibiotic resistance is one of our most serious health threat. Infection from resistant bacteria are now too common, and some pathogens even become resistant to multiple types of antibiotics or class of antibiotics. Think about the patients who is going dialysis for renal failure or taking treatment for cancer or undergoing any surgery like organ transplantations. So there will be the high risk for secondary bacterial infections. So for this they need antibiotic. If all available antibiotics got resistance, then what will happen to this patient? Or think about that, one small cut or wounds can take your life if all available antibiotics are not effective. So now I will tell you how this bacteria passes their resistance genes to other bacteria and getting the resistance too. The resistance gene is transferred to other bacteria by three different processes: conjugation, transduction, and transformation. In conjugation process, they send their resistance gene to other bacteria by bridge-like connection, which is called pilus. Now the transduction. In this process, bacteriophage, which is virus, attack the bacteria and inject their viral DNA into the bacteria. And when it injects the viral DNA incorporate with the bacterial gene. After some time, the viral DNA leave the bacterial DNA and start replicating. So the viral DNA is replicating and new bacteriophage is formed. However, in this process, bacteriophage maybe contain the bacterial gene which is resistant because it accidentally packed the bacterial DNA instead of its own viral DNA. When this bacteriophage attack new bacteria, instead it gives resistance bacterial gene to other bacteria. The last is transformation. So in this process, when the bacteria contain resistance genes will die, the resistance gene will release and picked up by another bacteria and getting them resistance too. But now the question is, how this bacteria getting resistance to antibiotic? Antibiotic resistance occur naturally, but misuse of antibiotic in human as well as animal is accelerating the process. Example, overuse of antibiotic, like use of antibiotic in viral fever. Because antibiotic has no role on viral fever. It's a viral infections. The antibiotic only effective on bacteria, not on virus. Some patient not finishing the antibiotic course. Because of that, some bacteria still alive in your body and getting resistance. Using of antibiotic on animal to grow them faster instead of treating them. So this is one of the misuse of antibiotic in farm. Poor infection control in healthcare settings also can lead to antibiotic resistance. Poor hygiene and sanitization also can lead to antibiotic resistance because if you cooked hygienically or if you wash your hand thoroughly with soap and sanitizer, then there will be less chance to getting an infections and use of antibiotic can be reduced. So these are the some reasons why the bacteria is getting resistance to antibiotic faster. If you can control this, then definitely the bacteria will resistance slower. So guys, I will tell you some tips. If you follow this, definitely we can slow down the antibiotic resistance process. Only use antibiotics when prescribed by certified health professionals. Never use antibiotics by your own. Never use antibiotic if your health worker said you don't need this. Use full course of antibiotic and never share your leftover antibiotic to others. Prevent infection by washing your hands with soap and hand sanitizer. Prepare food hygienically and take vaccination up to date to prevent the antibiotic resistance. Only give antibiotic to animal under veterinary supervision and never use antibiotic for growth promotion. These are the things, if you follow this, definitely we can slow down the antibiotic resistance. So guys, please promise that you will never use antibiotic without supervision of a registered health practitioner. Thank you guys.